it made me realize that I really had no idea how my brain worked. This cannot be a coincidence. So I decided to actually take this huge leap and shift my entire career from molecular biology into neuroscience. If we pay attention, will everything else take care of itself? What if instead we really learn how our minds work and see how we're getting caught up in these cycles of addiction? There's a worm addicted to eating grape leaves. Suddenly he wakes up, call it grapes, whatever. Something wakes him, and he's no longer a worm. He's the entire vineyard, the orchard too, the fruits, the trunks, a growing wisdom and joy that does not need to devour. That I would rather fail at my career and study something that I love to do than be successful and just keep doing what I was doing that I wasn't as passionate about anymore. That joy can open us up to be in more of a kind of a growth mindset. If you think of Carol Dweck's work, fixed versus growth mindset, where we're more open to being curious and seeing possibilities that others might not have seen, or we might not have even seen before, and say, oh, what about that? So I looked at this operant conditioning stuff that had been around for like half a decade, and I'm like, why isn't anybody studying this? And I'm sure some people were, I just wasn't aware of it. But to me, it's like, well, that looks interesting. It seems to line up. Let's go study that, instead of somebody saying, oh, you need to find something more sophisticated or something, more complex or something like that. So yeah, I think the long and short of it would be, take risks, follow your passions, but I think importantly, follow the curiosity. So there can be risk taking that's just taking risks because it's exciting. And there's a difference between excitement and curiosity.
Today, we are going to continue a talk series that is being organized by Neuroscience Interest Group at International Society for Addiction Medicine. And we are really thankful for kind of supports from IBRO, International Brain Research Organization, also ISAM, International Society for Addiction Medicine. My name is Hamed Ekhtiari, and I'm one of the co-chairs of Neuroscience Interest Group at International Society for Addiction Medicine. As you can see here, we have a series of speakers in this talk series. And every month we speak with one of these speakers talking about their personal experiences and why they are interested to addiction neuroscience and why they have decided to invest their entire life or a big part of their life to the addiction neuroscience, and why they are encouraging other kind of young investigators to follow what they have done, and what are the advices that they have for young investigators and kind of next generation of people who might be interested to come to addiction neuroscience. As you can see here, we tried very hard to be able to have a diverse set of speakers from different backgrounds, from different countries. And we highly encourage you to kind of nominate speakers from other countries around the world that could be joining us for the kind of next series of this talk series. So we definitely be happy to invite people from different countries around the world. And we really like to have a kind of a wide range of different speakers and also audience around the world. And I received lots of really nice emails from people in different countries around the world, from India, from Brazil, from Russia, from different countries. And it seems that we are kind of receiving a really good wide range of kind of different backgrounds in terms of the audience that we have. And that is really exciting to see how we can have the next generation of kind of addiction neuroscientists from a really diverse background in the field. Today, we are going to have Dr. Judson Brewer. Dr. Judson Brewer right now is an associate professor at Brown University. He is also research affiliate at MIT. Dr. Brewer is a psychiatrist, an international well-known expert in mindfulness training and addiction. And Dr. Brewer developed different novel mindfulness programs for behavior change, including both in-person and app-based treatments for smoking, emotional eating, and anxiety. Dr. Brewer has also kind of developed different sort of kind of studies for exploring neural mechanism of mindfulness and how we can use mindfulness in different clinical settings. He has a really kind of active website, so you can see his website as you can see here in this slide. He has also published numerous different peer-reviewed articles and book chapters. He has also presented to the U.S. President Office of National Drug Control Policy, different foreign parliaments. He trained U.S. Olympic athletes and coaches, foreign government ministers. And also, he has been featured in 60 Minutes. He has several really exciting talks in TED, so it's really kind of highly recommended to see his talks in TED. He has been featured in New York Times, Times Magazine, Forbes, Business Weeks, NPR, National Geographic, BBC, and he has a really active on both YouTube and Twitter. So I highly recommend you to follow him there. And also he has published a book on with the name of Craving Mind. I have received a message from one of my friends in Iran last night that he was really excited because he was following his work and he was reading his book in Iran, and he was really interested to see him here in the talk today. So obviously he's attracting people and audience from across the world, and that is really exciting to have Dr. Brewer with us today. So please join me in welcoming Dr. Brewer. And Dr. Brewer, the floor is yours.
At the beginning of medical school, that I started meditating personally as a way to help work with stress and anxiety myself. And I found that I had no idea how my mind worked because I could not concentrate for anything. I went on my first week-long silent meditation retreat, and I ended up crying on the shoulder of the retreat manager because I couldn't do the simple thing, which was to pay attention to my breath. That was the instruction for the week: pay attention to your breath. When your mind wanders, bring it back. And I'd made it into medical school. I was doing all right in medical school, and yet I couldn't do this simple thing. And it made me realize that I really had no idea how my brain worked or my mind worked. So I started just personally meditating. I was doing my PhD actually in immunology, looking at the neuroimmune interactions related to how stress and the immune system interact and how this is modulated by the brain. And I decided, to become a psychiatrist because of not because of what I was learning in my PhD, but actually when I went back onto the wards in my third year of medical school after finishing my PhD, I started to see these parallels between how my patients, especially my patients with addictions, were talking about what they were struggling with. They were talking in terms of craving, in terms of holding on, clinging, trying to force themselves not to use. And this was the same language that I'd been learning in my own meditation practice through some of the Buddhist psychology I'd been learning. And I was thinking, this cannot be a coincidence. So I decided to actually take this huge leap and shift my entire career from molecular biology into neuroscience. And I was very fortunate to be in a residency training program that really welcomed and allowed people to to retool and do research even during residency. I was at Yale, where they have this great neuroscience research training program. And I said, well, I'm gonna see what this mindfulness stuff is all. And it turned out to be the most fascinating journey, because I started to learn, over those 8 years of my MBA PhD program, I started to learn something about how my own mind worked. And when I started practicing medicine, especially addiction psychiatry, I started realizing that the current tools that I was taught, there was something that either I wasn't using them well, or something was really leading to my patients struggling. And so, if somebody came to me and they wanted to quit smoking, I could give them Brenaclean or a medication and say, give them a quit date for 2 weeks out, all these things that I'd, use the 5 A's, all these things I'd been taught. But basically they were encouraged to use their willpower to quit smoking, assisted by medications perhaps. And this was the case for a lot of other addictions, cocaine, heroin, alcohol, all these things. We're talking about no problem can be solved with the same level of consciousness that created it. And the reason I like this quote is that it seems that we are, at least with things like cognitive therapies, we really rely a lot on our prefrontal cortex. That seems to be one of the primary seats of cognitive control. If you think of cognitive control being related to working memory and things like this, Yet this part of the brain, it seems, is the youngest and the weakest part of the brain from an evolutionary perspective. So, are we missing something? Is there something that I had been missing that was leading to my patients really, really struggling with their addictions? And then I started thinking about, well, how do we actually learn habits? And it brought me back to something I'd probably learned in college and forgotten about. But some of these very, very simple reward-based learning mechanisms that were, I'm just showing an example of B.F. Skinner because he made some of these most famous, because he was really interested in this fundamental question of, why do animals behave the way they do? And it's not just for, pigeons learning, maybe I can show you, there's this short video of Skinner from the Skinner archive showing that pigeons actually playing ping pong, and he found that he could teach a pigeon to win a cross-court shot in ping pong for a food reward, and really came up, with some of these basic mechanisms suggesting, that this is how a lot of habitual behavior is learned. And this applies not only to, hardcore addictions, but applies to everything from social media to cell phones, even to eating. There's a lot of research out now showing that we learn to eat not when we're hungry, but when we're stressed or when we're bored or when we're anxious. In fact, I'll maybe use an example of one of my patients that I've been seeing in my clinic recently. This was a gentleman who was actually referred to me for panic disorder. And he described how he would drive on the highway and he would get panicked to the point where he started avoiding driving on the highway. And even coming in to see me, driving just a few miles on the local roads, he looked extremely anxious. Not only did this gentleman meet all the criteria for panic disorder, he also met the criteria for anxiety or for generalized anxiety disorder, but he also was very, very overweight. He was about 180 pounds overweight. And what we did in that first visit was just to map out a very, very basic habit loop around, how he had formed the behavior of panic. And this actually goes back to, the very basic mechanisms of reward-based learning. So, we all learn to remember where food is. It's a survival mechanism through, a trigger, a behavior, and a reward. You see food, you eat the food, and your stomach sends this dopamine signal to your brain that says, remember what you ate and where you found it. So how does this relate to my patient? Well, I had sent him home and I said, start mapping out these habit loops around your own anxiety. What is it that triggers you to, well, for example, he would drive on the highway and he had a thought, I'm going to kill somebody. That was his trigger. His behavior was to avoid driving on the highway. And then the reward was that he wouldn't get into those very stressful situations. So I sent him home, and 2 weeks later, he came back and his instruction was to just map out these habit loops. And he said, oh, doc, I lost 14 pounds. And I looked at him trying to recall our previous conversation, because I didn't think we'd even talked about his obesity. He was very overweight. He had a fatty liver because of it. He had hypertension because of his obesity. He also had obstructive sleep apnea. And he said, as I started mapping out these habit loops around anxiety, my trigger was I was anxious. My behavior was that I would eat. And then I realized it's not very rewarding at all. So I stopped doing it. And over the course of those 2 weeks, he became disenchanted with his eating behavior because it wasn't actually rewarding his brain very much. And so here's an example of how these basic learning mechanisms that are there for every known drug of abuse can even be perpetuated and learned in other types of psychiatric disorders. For example, stress eating or anxiety eating. We've even seen this a lot in the current pandemic. In the U.S., they describe this as the quarantine 15, because a lot of people gain about 15 pounds or about 8 kilograms when they have ready access to food. They're working from home. Maybe they're bored or they're stressed, or there's a lot of uncertainty, and that uncertainty drives them to actually, to eat, and they eat as a temporizing measure. So this got really fascinating for me to really understand these mechanisms and see how they actually played out in my clinical life with my patients. So I wanted to study, what's actually going on and how can we affect this process. So I retooled my career and started asking, well, what can effectively treat this type of behavior, whether it's a classic addiction or even a behavioral addiction, what's going on in the mind, and how can we actually target this? And this is where, things came together in a serendipitous way where, I've been meditating for about 10 years at this point. And I was thinking, well, I'm seeing this in my clinic. I'm seeing my patients describe these same terms, these same words that I'm learning in Buddhist psychology. Why not look at mindfulness training, and can mindfulness training actually help some of these hardcore addictions? So just as for anybody that's not familiar with mindfulness, I like the simple definition that Jon Kabat-Zinn put forward. He talks about paying attention in the present moment, on purpose, and non-judgmentally. And what he's talking about here, if you think about this mechanistically, is, we're talking about this positive and negative reinforcement. So for example, with addictions, there are all these things around, there's a positive cue. Maybe we eat a good meal and we have an urge to eat some dessert, or we have an urge to go and have a cigarette. And then that reinforces the process. And then it also increases the salience of other positive cues. So current treatments, people, places, and things. If you avoid people, places, and things, you're less likely to drink or smoke or whatever. It can be harder if you're smoking in particular to avoid all the places that one smokes. So that's where substitute behaviors come in, eat some candy instead of smoking a cigarette, but that also can lead to the post-smoking 15, where a lot of people gain weight after smoking. So we asked this very simple question. I'd look at my patients who are struggling with quitting smoking, and in fact, could we insert this? Think of this as this wedge of awareness, this wedge of mindfulness in between this urge to do the behavior, the habitual behavior, and the behavior itself. So instead of habitually reacting, could we respond simply through bringing awareness in? So for example, I had a patient who'd been smoking about 40 years, and we calculated the number of times he had reinforced his habit loop. Roughly 293,000 times was the calculation that we came up with. And he had tried everything to quit smoking. He tried medications, he tried, willpower, all this. But the fact was that he didn't actually know how his mind worked. And so we started implementing, something that I had been studying. This was about 10 years ago that we'd done this research. So I'll just go through it really quickly, which was, can we actually help people pay attention to what's happening? And does that awareness actually help to change that habit? You can think of it this way. If we pay attention, will everything else take care of itself? And this is what folks started noticing, and not only in our clinical studies, but also in my clinic. Here was an example of somebody who said, mindful smoking, it smells like stinky cheese and tastes like chemicals, yuck. And what this person was pointing out was that we could actually tap into this reward-based learning system. So if somebody was triggered to smoke, and they really paid attention to what that reward was or how rewarding it was, they could see that it might not actually be that rewarding. Or as somebody else put it, like Yogi Berra, he says you can observe a lot just by watching. So long story short, we published this a while ago, so I'm not going to go into the details. We got 5 times the quit rates of gold standard treatment with mindfulness training for smoking. This blew me away. I was thinking, wow, this is amazing. What's actually going on in the brain? When people are working with these addictions this way, by bringing awareness to their natural situation. So, I'll talk a little bit more about some of the neuroscience that I've been really fascinated with, and then I'll talk a tiny bit about some of the pragmatic applications of this, and then we'll open it up to a discussion. So I'm thinking maybe we could start with a just a kind of a story. And, I love this. There's a story of Lola Jones, who's this Olympic hurdler. And back in 2008, so she's a 3-time Olympian, but back in 2008, she was favored to win the 2008 Olympics. And in fact, she'd made it all the way through the preliminary rounds, all the way to the finals, and actually all the way to the 9th of 10 hurdles. And in an interview with Time Magazine, I'll just summarize this. She said, I was just in an amazing rhythm. I felt like, I wasn't like, oh, I'm winning the Olympic gold medal. I just feel like, it's another race. And then she said, at a point after this, I felt like, I was telling myself to make sure my legs were snapping out. So I overtried. That's when I hit the hurdle. And I'm telling this story because this is one of these fascinations about awareness and about mindfulness that is often misconceived. So often people think mindfulness is about ridding their minds of thoughts. But in fact, that is a fallacy that falls right into this whole, cognitive control obsession, I think, that we have as a society. If I could just control myself. It's not just us. This goes back, hundreds of years. This, in the Parthenon, there's this relief showing this rider and this horse battling, and the horse being passion, and the rider being, trying to control these passions. And, our passions are much stronger than our cognitive control. So the idea, perhaps, is not that we should try to gain, a whole bunch of cognitive control, because I'm not sure that actually is going to do it for us. But in fact, learn how our minds work, and instead of kind of, trying to force ourselves to do something like Lola Jones was trying to tell herself to make sure her legs were snapping out, what if instead we really learn how our minds work and see how we're getting caught up in these cycles of addiction and craving, or basically, see how we get in our own way, as this meditation teacher put it. Now, what do I mean by getting in our own way? You can think of this as a continuum of getting caught up in experience, like daydreaming. Whether it's, some studies show it's about 50% of waking life that we're caught up in a daydream, but that's something that we can snap out of pretty quickly. Stress, boy, it'd be great if we could snap out of stress, but that's a little harder. And then addiction, the far end of the spectrum. I like the simple definition that's basically ASAM's definition, where it's like continued use despite adverse consequences, because this isn't just about chemical addictions. This is about any behavior that leads to adverse consequences. And we all know what it feels like to get caught up in something, whether it's getting caught up in stress, or getting caught up in anxiety, or getting caught up in a craving. And in fact, we can study this. I'll show an example. There's a study that was published a couple of years ago. This came out of UCLA, where they were showing adolescents their own Instagram feeds, and they basically just made one manipulation as they were scanning their brains, which was to give some of the pictures likes and some of the pictures not as many likes. And they found that they were activating the reward centers, like the nucleus accumbens, so the reward system, but they were also activating the self-referential processing system. In particular, it's anchored by the posterior cingulate cortex. This is the default mode network that probably many, many, many people are familiar with. Don't worry about the details, but this is, kind of a diagram of the network, where you can see that the posterior cingulate and the medial prefrontal cortex are the hubs of this very rich and elaborate network. Now, I'm bringing this network forward because this is something that gets consistently activated with addiction. So, for example, the posterior cingulate gets activated with cocaine cues. Hugh Garavan's group showed that. Amy James's group has shown that it lights up like a Christmas tree with smoking cues. This also happens with pathological gambling. When people are shown pictures of people gambling, it gets activated. So we can see this all over the place. And the default mode network was interesting, as well as this idea of getting caught up in experience, because with addiction, where we're really getting caught up, and we can also introduce a variable to see if we can affect this system. So mindfulness training is about helping us not necessarily change anything, but change our relationship to what's happening. So not get caught up in our cravings, so to speak. So you can think of this as, and we published a paper on this a few years ago, that the posterior cingulate might be a marker of actually getting caught up in experience. Think of it as that experiential marker of self. And mindfulness training is set up as a way to help us not get caught up in this experience. Long story short, we started studying experienced meditators and looking at their brain activity, and we found, lo and behold, when we looked across the entire brain, there were only 4 brain regions that were significantly different between groups, between novices and experienced meditators. And lo and behold, 2 of these 4 brain regions were the medial prefrontal cortex and the posterior cingulate, these 2 hubs of the default mode network. So we thought, wow, this cannot be a coincidence. Fast forward 5 years, we'd gotten an NIH grant to actually study how we could link mindfulness training to these neurobiological mechanisms. And we added a twist here, which was, we said, well, let's deliver mindfulness training in context. So people don't learn to smoke in my office. So what if I brought my office to them? Because this reward-based learning system is set up to help us develop and lay down context-dependent memory. Like, remember where food is, go to it again. Remember where danger is, avoid it. And so we set up this this study. This is in collaboration with Amy James, actually, using her smoking paradigm, where we could bring people in who wanted to quit smoking. We could show them smoking cues versus neutral cues, check to see how much their default mode network was activated, in particular focusing on the posterior cingulate cortex. Then we could randomize them to get app-based mindfulness training program or the National Cancer Institute's Quit Guide app. A month later, we could bring them back in and see if their brain activity changed and if changes in their brain activity actually predicted clinical outcomes. Long story short, we published this last year. We found that a reduction in posterior cingulate activity correlated with a reduction in cigarette smoking. You see this correlation is about 0.4. But this is very, very specific to the mindfulness training group. The active comparison showed no correlation. In fact, we found a dose-dependent relationship where the correlation was about 0.49, where the more modules people completed, the better they did. Yet, in fact, the folks in the control group completed about the same number of modules, but showed no correlation. When we brought these 2 variables together with the baseline number of cigarettes that people smoked, we could actually account for, I think it was 59% of the variance in reduction in cigarette smoke. So here we could start to see, this theory that I'd started to link through my own personal experience and through, my residency training about, does mindfulness training actually help people with craving? Link this together with some of the neuroimaging findings we'd had with experienced meditators. Could we actually target these specific brain regions? And with that targeting of the brain regions, could we actually predict clinical outcomes? I think of this, for me in science, that's the holy trinity, lining up theory with neural mechanisms and as well as clinical outcomes. So this was really, really exciting to us. And in fact, we went on to do a bunch of neurophenomenologic studies to line up specific, subjective experience with brain activity. Maybe I can show you. I'll just give you an example of how that works. Where we published this a while ago, but this is some of the most fun research that I had ever done. In fact. We learned something from almost every scan that we did, where we were giving people active feedback from their posterior cingulate cortex. We could also give them dummy feedback as a way to control for their, for them believing the machine over their own experience. And we could really see how brain activity lined up with their experience. Tell me if you can hear the sound on this. I'm just going to play this short video.
This is just the next generation of exercise. We've got the physical, exercise components down, and now it's about working out how can we actually train our minds.
Dr. Brewer is trying to understand how mindfulness can alter the functioning of the brain. He uses a cap lined with 128 electrodes.
We're going to start filling each of these 128 wells with conduction gel.
The electrodes are able to pick up signals from the posterior cingulate, part of a brain network linked to memory and emotion.
This is all just picking up electrical signal from the top of your head.
Since attending the mindfulness retreat, I'd been meditating daily and was curious to see if it had an impact on my brain.
we're going to have you start with thinking of something that was very anxiety provoking for you.
Okay. When I thought about something stressful, the cells in my brain's posterior cingulate immediately started firing, shown by the red lines that went off the chart on the computer screen.
Just drop into meditation.
Okay. When I let go of those stressful thoughts and refocused on my breath, within seconds, the brain cells that had been firing quieted down, shown by the blue lines on the computer.
That's really fascinating to see like that.
Dr. Brewer believes everyone can train their brains to reach that blue mindfulness zone, but he says all the technology we're surrounded by makes it difficult.
So, as we were learning some of this neuroscience work, linking these things up, we could start to think about how can we actually develop these digital therapeutics, whether it's providing people with real-time neurofeedback from their default mode network. That's still in R&D stage. In my lab, I'm sure others are trying to develop these types of technologies as well. But we could also start to, test other behaviors that fall into the habits in the addiction realm to see if this, if this could apply not just to smoking, for example, or not just to Anderson Cooper, who really seemed to nail this pretty quickly. He'd been meditating, as you heard, he'd been meditating for about a month. But how else could this affect behavior? So we developed a couple of app-based mindfulness training programs and started studying them. So for example, one for eating, helping people with craving-related eating in a study led by Ashley Mason at UCSF. She found we could actually get a 40% reduction in craving-related eating, a 35% reduction in eating to cope with negative emotions. So even targeting the specific negative reinforcement process, where if somebody has a negative emotion, that triggers eating, and that would lead them to eat as a brief relief strategy. We've also checked to see if we could actually affect anxiety, and so developed this anxiety app. This was a study with anxious physicians. This was an open label study, relatively small, but we just wanted to see if it would have an effect. Here we found that we could get a 57% reduction in clinically validated anxiety scores. This is a generalized anxiety disorder 7 scale. And you can see that folks went to moderate to severe anxiety at baseline, all the way down basically to minimal or just above minimal anxiety at 3 months. With NIH funding, we replicated this study in people with generalized anxiety disorder, where we gave them usual clinical care, seeing their clinician, getting medications, whatever, or that plus this app. And, again, relatively small study, but we still found that there were significant reductions in anxiety that were much greater in the active group compared to the comparison group. There was about a 15 or 16% reduction with clinical care, so that's not insignificant, but much smaller than the 63% reduction that we found with the app. And here, for any clinicians out there that are familiar with this number needed to treat, which basically means how many people do you need to give a treatment before one person benefits? The number needed to treat for medications is about 5.15. And here, we found that the number needed to treat was only 1.6. So I think just, bringing all this together, what this suggests is that, if you look at some of these very basic learning mechanisms like reinforcement learning, this is actually a very approachable target, whether we approach it neuroscientifically or whether we approach it behaviorally. And the story actually gets even more fascinating with this, but we wanted to see if we could get some outcomes first, behavioral outcomes, some of the neurobiologic outcomes, before we really dove even more specifically into mechanism. And, what we started exploring was reward value, right? Because, from a neuroscientific standpoint, it seems that there's a pretty consistent story around how reward value really drives future behavior. You set a reward value and then kind of lay it down in habit, and then your brain says, okay, I get a choice between these different behaviors, and I'm going to pick the one that's more rewarding. A simple example of that would be, this is why we don't feed our kids dessert and vegetables at the same time at dinner, because it's a no-brainer to their brain which one's going to be more rewarding. And in fact, our brains set up this reward hierarchy, so where they're going to pick which behavior is more rewarding. So, for example, I'll give from my own life. My brain has this reward hierarchy around, let's say milk chocolate and broccoli. So milk chocolate's going to be more rewarding. If I eat dark chocolate, it's going to compare milk to dark chocolate. For me, definitely dark chocolate. But in fact, this system is something that has a very, very beautifully articulated mathematical structure to it. And probably many of you are familiar with the Rescorla-Wagner reinforcement learning models. These have been around since the 70s. They've been embellished upon a little bit, but the basic function has really survived decades and decades of research. And long story short, we develop a reward value based on repetition in a behavior. And then whenever we're faced with doing that behavior again, our brain is going to determine whether, when we do the behavior, it's just as rewarding or more rewarding or less rewarding than the reward value that we have laid down. So if it's more rewarding, we have what's called a positive prediction error. If it's less rewarding, we get what's called a negative prediction error. And this is what actually updates that reward value system and potentially affects future behavior. So for example, by bringing mindfulness training in, I can have my patients really pay attention as they smoke a cigarette. And as you saw from that earlier example, there's often this negative prediction error that happens. So somebody expects to feel content or feel good after smoking, yet when they actually pay attention, they realize that the cigarette doesn't taste very good. So they get this negative prediction error, and this updates in their brain. And in fact, we can build these types of models right into our digital therapeutics. So we can have people, this is with our eating app, for example, we can have people bring to mind the food they're going to eat, imagine eating it, and really imagine going through all the steps, and then determine, do they want that more or do they want that less? And then we can actually model this out. So this is work led by my postdoc, Veronique Taylor, where you can actually put this into reinforcement learning models, and you can see after people use this craving tool quite a bit. So there's the imagining part, and then we have them actually, if they want to eat, we say go ahead and eat, but pay attention as you do. And as they really pay attention, you can see over the course of using the tool a number of times, the reward value of eating actually drops below the reward value of not eating, and then they start to select not eating over eating relatively quickly. Now this is a relatively small study that we did. So we replicated it in a larger sample, and then we took a community sample of over 1,000 people and found that it was actually within about 10 or so craving tool uses that we saw a significant reduction there. So it was really neat to see that these Rescorla-Wagner models were actually lining up pretty nicely with people's behavior, and that these could be modeled in vivo using these digital therapeutics. Just to follow that up, we did a study with people with using the Craving app, the one that I showed you that changed their posterior cingulate activity. And we could see in a sample of about 110 individuals, we saw a significant reduction in smoking as compared to relative to not smoking. And you could see a shift also in behavior from smoking to not smoking. So, bringing all of this together, what I would suggest is that instead of, going to these old behaviors, through this reinforcement learning model, whether it's eating or worrying or smoking or drinking, that in fact, mindfulness training helps us provide a substitute behavior, but a specific substitute behavior that's intrinsically available and doesn't become habituated. And here I turn to Lewis Carroll in the book Alice in Wonderland. She exclaimed, "Curiouser and curiouser." And the reason I bring this quote up is that what I would suggest is that mindfulness is about teaching us to be curious. And if we can bring curiosity to our direct experience, it might actually be a more sustainable solution than always reaching for something and becoming habituated to it and needing it more. I'll give an example, a clinical example of somebody using our anxiety app. This person said, when I first started the program, I didn't quite buy into the benefits of curiosity. Today, I felt a wave of panic, and instead of immediate dread or fear, my automatic response was, that's interesting. That took the wind right out of its sails. I wasn't just saying it was interesting, I actually felt it. And what this suggests is, bringing all of this together, is that we can, we've got this automatic path of behavior. We see the food, or we see the, go by the liquor store or whatever, then we automatically act out on the behavior, and then we get these results that are actually misaligned with our goals. And this can feel like we have no choice, that we're caught up in it. It feels depleting. So, some of the traditional treatments are to kind of force ourselves. So just don't eat the cake, just eat salad instead of cake, or, just don't smoke that cigarette. And in fact, that behavior, can be aligned with our goals if we can force ourselves not to eat, but that also feels constricted. It feels depleting. If you believe any of this willpower depletion or ego depletion research, which is pretty controversial, so I'm not going to give my opinion on one way or the other. But if you believe that, even with it being aligned with goals, still has this constricted quality. Well, what these data suggest is that there might actually be a third alternative. That same trigger can trigger curiosity. We can get curious about those, what we get from this, and start to change that reward value of the behavior. And then we can start to see, oh, these are just sensations that are coming up. I can actually be with these sensations, and it feels better to be curious about what's happening rather than to get sucked into the process, to get caught up in it. So those results are not only aligned with our goals, but they actually feel great. They don't deplete us, because we see, oh, that curiosity actually engenders more and more curiosity. So, what this suggests, bringing it all together, is that we can actually rely on a lot of these very, very basic systems. And in fact, I really love the parsimony here, and the simplicity and the explanatory power of these very simple reward-based learning systems. And also that, just bringing awareness in can help to update that reward value, so that we're naturally disenchanted with these old behaviors and more enchanted with things like becoming, and getting more and more curious. Where he says, there's a worm addicted to eating grape leaves. Suddenly he wakes up, call it grace, whatever, something wakes him, and he's no longer a worm. He's the entire vineyard, the orchard too, the fruits, the trunks, a growing wisdom and joy that does not need to devour. And I really think that's, that's part of the joy of the work that I've been very fortunate to be part of. And in fact, I just want to show you all the folks that have been involved in this work. To just really get to follow my curiosity, follow this joy of discovery, and at the same time, follow the joy that comes from seeing how my patients are benefiting from this. So just to follow with the story of the patient that I mentioned at the beginning, who had this panic disorder, he had generalized anxiety disorder. He'd come in after 2 weeks of mapping out his habit loops. He'd lost 14 pounds. In fact, over the course of 6 months, he ended up losing about 100 pounds, simply through kind of mapping out a system using these mindfulness practices. And his hypertension resolved, his fatty liver went away, his obstructive sleep apnea resolved. Yet, how did he do with his anxiety? Well, I was walking out of class. I was teaching class at the School of Public Health at Brown one day, and it's on South Main Street in Providence, Rhode Island, along the sidewalk, and this car pulls over. This guy rolls down his window. It's my patient. I look over to him, thinking, oh, great, he's driving. He gives me this big smile, and he says, I'm an Uber driver now. I'm an Uber driver now. So imagine that, when somebody can just truly learn how their mind works, they become, the master of themselves, rather than forcing themselves to, drive or to stop eating, to simply follow that joy of discovery and seeing, oh, this isn't doing it for me. Well, here's an alternative, which is to simply, live life as he was doing. So I will stop there, and I'd be happy to open this up to questions and discussion. We've got actually for physicians out there, we've got some free CME courses through Brown if you're interested in learning more about mindfulness. I've got a bunch of educational videos and animations even on my website about reward value and everyday addictions and things like that in case those are helpful. We have a bunch of resources on the Mindfulness Center at Brown if you're interested in those. Or if nothing else, you just follow the poet Mary Oliver's instructions for life. You know, pay attention, get curious or be astonished, and then share that with others. So I'll stop there and would be happy to jump into some discussion.
Great job, Dr. Brewer. It was a really inspiring talk, like all the other talks that you have presented. Let me kind of start the discussion and the questions. We have many medical students right now among the audience. And the community, International Society for Addiction Medicine, basically received lots of kind of really interesting feedbacks from medical students around the world about this talk series about neuroscience. As a medical student, I had this experience of receiving feedbacks from my supervisors and colleagues. When I was planning to go for psychiatry, people were making comments in terms of, okay, what a waste. I mean, you should go for, let's say, cardiology, kind of plastic surgery, ophthalmology, on kind of other sides of kind of medicine. As a really successful psychiatrist who has been able to do both really state-of-art neuroscience studies and also being able to bring addiction to a really kind of a transdiagnostic level, in a way that is related to not only kind of drug users, but also anxiety and eating and this something that is related to the daily life. And also being a really great communicator. I mean, you have been successful to kind of bring attention to the field from, I mean, even key leaders around the world. What are your advices in terms of how people can come to the field of psychiatry or addiction medicine and not be a big waste?
You must have had the same medical school professors that I had. I remember one professor apologizing to me the next day after he told me that I was going to waste my brain. And he said he felt bad all night for telling me that, for going into psychiatry. And in fact, I remember somebody telling me I was going to kill my career by studying mindfulness training, because I'd, done some decent molecular biology work, and they're like, why don't you just keep doing that? So my advice here would be to follow your passions. My passion was to really see what the story was with mindfulness training. And I remember making a pact with myself that I would rather fail at my career and study something that I love to do than be successful and just keep doing what I was doing that I wasn't as passionate about anymore. So, peer pressure is real, especially if it's coming from your professors and your colleagues that are all successful, and, you're just starting out your career and you don't know whose advice to believe. You're going to spend a lot of time doing this work. And so it's really important to enjoy what you're doing. And I also think that joy can open us up to be in more of a kind of a growth mindset. If you think of Carol Dweck's work, fixed versus growth mindset, where we're more open to being curious and seeing possibilities that others might not have seen, or we might not have even seen before, and say, oh, what about that? So I looked at this operant conditioning stuff, and been around for like half a decade. I'm like, why isn't anybody studying this? And I'm sure some people were, I just wasn't aware of it. But, to me, it's like, well, that looks interesting. It seems to line up. Let's go study that, instead of somebody saying, oh, you need to find something more sophisticated or something, more complex or something like that. So, yeah, I think the long and short of it would be, take risks, follow your passions. But I think importantly, follow the curiosity. So there can be risk taking that's just taking risks because it's exciting. And there's a difference between excitement and curiosity, and we can even feel this experientially, that excitement has this restless quality to it because it says, go do something, right? Because it's prompting us into action, probably dopaminergically mediated, I would guess. But that feels very different than curiosity, especially there are two types of curiosity. There's this interest curiosity where we're just interested in what's happening. There's this joy of discovery. That feels much more open and much more, where we're willing to explore and not try to find, rush to find some answer and be excited about it. It's really gives us the patience to ask, well, what's really going on here, instead of, oh, here's something, I'm going to try to nail that.
Rita, do you want to ask your question?
Hi, Jad. That was a great talk, really so informative and giving this overview, and the results are so exciting and really inspiring. We're setting now our own mindfulness study in heroin addicted individuals. So it will be very, very interesting to see if we can see some similarities and compare results when we have done that. But my question was more about individual difference and timing. So in your experience, do you see any individual differences in response to mindfulness and meditation? And is there a dynamic way to think about it? So maybe some people would be more amenable to the effects of mindfulness in sometimes more than other times, or do you see any characteristics that make a person maybe less susceptible to those positive effects?
Yeah, it's a really good question, and I'm really excited to hear about your results when you all get some of those. So yeah. So here we've only just started to scratch the surface of this, and I would say the first hint we've gotten of this is with our smoking results. So this work we've done with Amy Janes, and we got this. This is a post hoc finding, so it needs to be followed up. But we found that 13% of people, regardless of what treatment they were randomized to, so this was at baseline, 13% of people showed no brain reactivity to these smoking cues, 0. And that lack of reactivity predicted whether they would benefit from mindfulness training or not, and didn't predict anything in the control group. So there, I think there's a signal there that's worth following. Again, 13%, not half of people, but it's, more than 10% of people. If there were some way, and we were using neuroimaging here, so that's a little expensive for a screening tool, but it suggests that there are ways to start to look at baseline characteristics, whether it's cue reactivity, and I know you and many others are interested in cue reactivity. So that might be a marker to start looking at, and if there is no cue reactivity for whatever reason, and this is only in smoking, so it may be different with other addictions, but if there is something that's where people aren't cue reactive, that might be a really good marker where we test to see, do we give those people other treatments as compared to mindfulness, because they may be less likely to benefit from it. I think there's a hint there. With smoking, there's also, somebody at Yale has been doing a lot of really good work with sex differences, men and women in particular, with smoking. It'll come to me in a second. Sherry, somebody, where, women have different, differential responses to cue reactivity, for example, emotional versus physical, like physical withdrawal symptoms, I think, in men, if I remember it correctly. And so again, this could also be related to specific addictions as well, in terms of how, whether there are sex differences. To my knowledge, nobody's actually studied those. Nobody's done studies large enough to do it. I would love to see those studies done, because those could be really, really helpful in informing, it's a lot easier to screen based on sex rather than, a baseline cue reactivity paradigm using fMRI.
So not mindfulness, but another study we conducted on cognitive reappraisal. So people with the lower severity of addiction responded better. Then that's what I was thinking. Maybe that's another marker by severity, or maybe you saw anything like that. So people who are more severe nicotine with their addiction, did you see any results there that were specific?
Yeah, it's a great question. Our sample size wasn't large enough to look at it. So I think if we were to follow on with a larger study, I'm glad you mentioned that. It's a relatively easy thing to look at. But we didn't get it. We didn't have a large enough sample to actually analyze that. So that's very interesting. Yeah.
Please introduce yourself first and then ask your question.
Okay, my name is Catalina Lopez. I'm an assistant professor at the University of Florida in the Department of Epidemiology. That I do my research is on substance use and mental health. And I'm interested in population neuroscience and how we can incorporate neuroscience into more population-based research. And my question is in relation to stigma and self-stigma, in particular for the population living with experiencing addictions. And if you have any comments on the use of mindfulness for this population and how that can help or contribute to their treatment.
And so, can you give me a little bit more around what populations you're talking about?
About populations with substance use, and particularly I'm interested in the issues like stigma and self-stigma and how that affects their process and how that affects some of the behaviors. For example, how that increase their use, or how that hinders the whole process for them therapeutically. So I was thinking whether mindfulness could be a tool incorporated for them, that actually they become aware of what they are experiencing and feeling, and improve their treatment outcomes.
Yes, I'm glad you asked this question. I think it's really important. What I've seen clinically is that, if you think of these habit loops, self-esteem can be a major trigger for substance use because, somebody has a low self-esteem of themselves, low self-esteem, or other people say, oh, says something not nice to them, which also decreases their self-esteem. That triggers them to use as a way to avoid those negative emotions. And then that spins them into this negative cycle. So you could see mechanistically how that can play a direct role in continuing use. I've certainly seen this clinically. I'm sure people are looking at this mechanistically. And so in that case, mindfulness could be very helpful in targeting that specific habit loop, in helping people see these negative self-images, for example, as thoughts. That's one thing that mindfulness trains us to do, as you're probably familiar with, is seeing thoughts as thoughts rather than something they have to believe, seeing it as who they are. And even that in itself, saying, oh, here's a thought, as compared to believing this as, oh, this is who I am, it can be tremendously helpful in people stepping out of those cycles. And in fact, there are mindfulness practices that are specifically geared toward helping people develop, think of it as higher self-esteem. There's a practice in particular called loving kindness that helps people practice kindness toward themselves and also kindness toward others. We published a paper about 5 years ago showing that you can actually change brain activity in the default mode network with loving kindness practice. It actually decreases activity in the posterior cingulate cortex, changes brain connectivity as well. So we know neurobiologically that mindfulness practices change these overactive brain regions. The posterior cingulate, in fact, gets activated with rumination. So I think with guilt, it gets activated with perseveration with anxiety, gets activated with rumination with depression. And I think there's an overlap there in terms of people getting caught up in these thoughts. So I think that would be a great area of focus in terms of somebody doing some research around specifically, giving people mindfulness training targeted at those, at that negative self-talk, for example, and seeing if that can specifically help their substance use. I think that'd be great.
My name is Ahmet Seseli. I'm a postdoc working in Mount Sinai with Rita Goldstein, actually. And yeah, what you mentioned about operant conditioning, and you said it was simple but effective perspective, and like it wasn't too complex. I wholeheartedly agree, and I think I thought maybe that could be also used to inform the mechanisms working here. For example, there's a whole lot of work that's from the motivational control literature showing that habit formation, the maintenance of habits could be linked to levels of cortisol. So there's work from Lars Schwab's lab, numerous studies showing like increased cortisol being associated with this outcome and sensitivity. And I was wondering if, given that mindfulness apparently, from what I've very briefly read, has links with cortisol as well. So like more maintenance of mindfulness practices with reduced cortisol, if that could explain the mechanisms here, or if I'm totally off the mark, what do you think is the mechanisms working that's making mindfulness so great about like reorganizing goals and maybe keeping a hold of habits?
That's a great question. I wish I had a great answer. As you probably know, cortisol research can be really, really messy. It's difficult to really accurately study and measure cortisol because there's so much individual variability. There's so many things that can affect the system, et cetera. I would say they're probably the most consistent work that I've seen with mindfulness and cortisol responses specifically are with like the Trier social stress test. So Liz Hoagie at Georgetown has done some really nice work there where she's measured not only cortisol levels, but also looked at pro-inflammatory markers and some early phase cytokines, such as like IL-1, I think, and maybe TNF-alpha. So some of her work might be illuminating there. In terms of mechanism, so certainly cortisol could be playing a role. I think there's a literature that keeps growing around what it's doing. We are starting to look, and I've been moving more toward trying to use neuroimaging to find, kind of neural networks that are involved more so than looking at neurochemicals, so to speak. It's just because it's so challenging to do. Although if you want to do it, great. We need folks doing that work. It's just challenging. So we're starting to look at some of these reward networks, and there's a good literature with the orbitofrontal cortex, for example, with reward valuation. I think there's a growing literature around how it even has anatomical connections with the posterior cingulate cortex. There's some good anatomical work that's being done there. So I think we're going to be moving in that direction to see if there are ways to look at the neural networks first. But the cortisol, I think it'd be really interesting to see those links solidified, especially around reward valuation. So I think that's a great idea.
Milad, do you want to ask your question?
Hello, everyone. I'm Milad from Tehran. I'm studying Master of General Psychology in University of Tehran. I had a question. Thank you, Dr. Brewer, for your great talk. It was really inspiring. Mindfulness is a kind of emotion regulation strategy, a person-oriented one. If it's possible that high levels of emotion sensitivity or emotion reactivity, more generally the dispositional state of the person against the world, it may be include the attachment styles. Do you think it's a important risk factor for getting more caught up in the thoughts you mentioned, or to crave more and to be more vulnerable to addictive behaviors?
Yeah, it's a really good question. I'm guessing you're onto something there in the sense of, if you think about this mechanistically, so for example, anxiety sensitivity, right? If somebody has a higher anxiety sensitivity, I think they're more likely to get triggered into anxiety, because think of that threshold of that trigger is lower. So they could be more likely to be triggered by things where other people wouldn't be as triggered. And we can see how that could even provide more sensitivity, where it feeds back on itself, where they become more sensitive and more sensitive. And then that leads to a disorder. So I could see that, applying also to addiction in probably in multiple ways, different types of sensitivities. So for example, I don't know this literature that well, but there's a fair amount of genetic research looking at, people's sensitivity, for example, to alcohol. Ismini Petrakis at Yale has done work around, showing that people have different, it just feels different when you have the same amount of alcohol in your system. And so that type of sensitivity could predispose somebody to being more likely to be addicted, for example, to alcohol. And we could see here how mindfulness could affect all of these things, helping them start to see, what it is, when they're getting caught up, and what the results of the behavior are, regardless of, what that level of sensitivity is, but also learning to have a higher distress tolerance. because I see the distress tolerance as being helping with the sensitivity. So if somebody's really sensitive, if they can learn to be with that, because sensitivity tends to lead to distress, if they can learn greater distress tolerance, that could help as well, as you're probably seeing as well. So that's where I think mindfulness can be helpful, is helping people learn to tolerate things that are distressful. Does that make sense?
Great.
Absolutely. Thank you.
Megan Anderson.
Hi, I'm Megan. I'm a postbac at NIDA right now in Baltimore, studying the hypothalamus and circuits that relate to addiction and anxiety. And I had a question in the chat. I'll just read it. But it seems like most of the patients that you're working with, or the experiments that you've done, have been on people who kind of come to you with a specific problem, like they want to stop smoking, or the guy that had trouble driving, and they're looking for treatment and want to actively try the mindfulness therapy. But have you seen any way this could either be modified or has been modified for maybe patients who are involuntary admitted inpatients, or people that aren't as inclined to stop their drug use or work on whatever issue they have?
Another great question. So here I think we can draw inspiration from the motivational interviewing community. And this links very nicely to how the reward value system is set up, right? If somebody is not seeing deleterious effects of their behavior, the reward system is not set up to change it, because it says, oh, we're all good, it's no problem here. And so it can be very helpful and I think this is where I love the paradoxical questioning of motivational interviewing, like, why not drink more? Why not smoke more? And what that can do is help people start to see very clearly in their own experience what it is that keeps them from smoking more, drinking more, drugging more, whatever. And so they start to tap into what those negative effects are. And those negative effects, the more they can see those clearly, the more that's going to drop that reward value, which is going to naturally help them start to change the behavior. Where mindfulness comes in, I think of it as kindly kind of rubbing their face in whatever their behavior is, so they can see really clearly how detrimental it is. And I've explored that a fair amount with patients who have been referred to me who aren't particularly excited to be in treatment. And so we spend time doing motivational interviewing related things, and also helping them really see very clearly that cause and effect relationship of the behavior. I think that's a key, and it actually goes way back to the early Buddhist psychology, where they talked about cause and effect. If you look at reward-based learning, it's not the behavior that reinforces behavior, it's the reinforcement, it's the reward. So it's not even focusing on like, I should cut down on this. It's focusing on, well, what is this causing me? And I think that's something that motivational interviewing and mindfulness training are both directed toward. So somebody's involuntarily forced into treatment, or they're incarcerated or something like that. The other thing that motivational interviewing highlights is not engendering resistance, right? And so if we take this top-down approach and say, you should, they're much more likely to do it. They're going to start resisting. And so this is where we can bring curiosity in and really try to understand, well, what is it that, that keeps you doing this, which also fosters connection as well as empathy. And so I think those pieces kind of come as side benefits of just being curious about what's happening, in somebody's life. And that's something, honestly, that keeps me going clinically is, I see a new patient, I do an intake, and it's like blank slate. I just want to know what your life is like. I want to be curious about your life. And that not only helps us connect, but helps me really see very deeply what it is that's ailing them that they might not even see, just through kind of bringing that forward. Does that make sense?
Yeah. Thank you.
Sure.
Thank you, Dr. Brewer. We are in the last minutes of this talk. So if you have any concluding point, any kind of final advices for especially young students and next generation of addiction scientists, we are all ears to kind of have your last notes.
So here I would, maybe I could just quote Einstein, who said something like, I've no special talents. I'm I'm only passionately curious. And so I would encourage folks to follow Einstein in the sense of just follow your curiosity. Follow your curiosity. I can't think of anything better to say than what he said.
Thank you very much, Dr. Brewer. Thank you very much. Have a good day. Bye-bye.